Merseyside Fire and Rescue Service is already one of the most forward-thinking organisations in the country. For us, it's not enough just to be technologically advanced, nor can we be satisfied with just having some of the best trained fire teams in the world. And even though our integrated management systems are nationally recognised as excellent, and our work with communities is leading and groundbreaking, well, we're always looking to do more, to challenge the causes of fire risk and fire death, wherever and whenever we can.
Any analysis of fire will show one simple fact, and that is fire has a social dimension. That those people facing the most challenges in the community, whether it be financial, whether it be personal health or well-being, or other factors, they are generally more vulnerable, but in particular, they pose a far higher risk to fire.
An immediately identifiable at-risk group are the elderly.
Our accident prevention team will go into a home and provide a home safety assessment. They will also have a look at fire safety, and if they feel that that person would benefit from a fire safety check, they will refer on to the fire service. Conversely, when the fire service do their home safety checks, if they discover that a person is frail, perhaps that person has a fear of falling, they will refer into our services.
The innovation behind our Fire and Health project not only revolves around positive intervention in the home, but also depends upon educating our communities so that they can minimise risks for themselves.
What today is about is showing local children in the area from all different primary schools how that they can stay safe in their community.
Normally children at that age don't see the consequences and the dangers, but when speaking to us is they get to see firsthand and hear firsthand of what the actions might lead to.
The Roycastle Foundation in Liverpool, through its commitment in reducing the incidence of lung cancer, has played a key role in communicating the dangers of inhaling cigarette smoke.
Smoking is the greatest risk of lung cancer, and therefore it's very important that clearly people don't smoke, and the fire service see it exactly the same way.
But cigarettes have another way of killing people, which is perhaps less publicised.
To reduce the number of house fires caused by cigarettes, we have to look at the root cause, and that means smoking itself. In simple terms, if less people smoked, there'd be fewer fires.
Smoking and drinking, though socially acceptable in our society, are in many ways twin causes of significant fire risk. Tackling these issues head-on within communities themselves, and involving the community in the search for solutions through awareness training, represents an innovation in fire and rescue delivery. Diane Hummerston explains.
Merseyside Fire Service give us added value because it's making our clients aware of the dangers within their homes. They can talk to the fire service, they can find out about those problems if there may be any, and it really is a lot of added value to our services throughout Merseyside.
We have fire stations throughout Merseyside in every part of the community, and they're far more than just places where we keep fire appliances or where firefighters go. They are an integral part of the community. They're a kind of safe haven, if you like, places where people can go and get good advice and support, and indeed use the facilities that are on the station for their personal well-being.
Many thanks to the fire service and a lot of cooperation from them, we were able to provide what we call outreach gyms based at fire stations. All the gyms have a range of exercise equipment which parallels the equipment in the Heart Support Centre itself. Thus people coming to the unit are reasonably familiar with the type of equipment we have in the outreach gyms.
And the idea is looking at healthy lifestyles, looking at fitness in young people, and building up relationships between young people in the community and Merseyside Fire Service. So early intervention with a group like the Fire Service, which has got that an attachment to young people, is great for them. It's good for the service because we're building up relationships, and it gets them into the fitness, the healthy lifestyle which firefighters must have to function their duties.
What we've got on the fire station here is a plot of land that was just lying here empty, and we decided to use it for the good of some of the young people who live in the local area, in terms of their healthy eating, healthy lifestyles, responsibility. There's an endless list of skills that these people have the potential to develop and take away with them.
Well, we've got huge experience in Merseyside through our occupational health programme, because we take the health and welfare of our firefighters so very, very seriously. Now we transfer that experience outside into the community, where we can have a real big impact on people's lives and people's health and well-being, and actually tackle at the root cause that link between health and well-being and vulnerability to fire.
We've embarked on something very new, a fire and health initiative that recognises and addresses the underlying causes of fire injury and death. We want to take this further and work with all our partners to build safer, healthier communities.